Hi, in this video I'm going to be talking about fear and breast cancer. Fear when you're first diagnosed, fears during treatment, fears when treatments are over, and fear if your cancer comes back. How to manage it, what are some strategies I've learned from my patients, and how to take the best care of yourself. So when people are first diagnosed with breast cancer, there's so much less known than there is known, right? You don't know what stage it is. You don't know your treatment plan. You don't know if you're going to be okay. And that lack of information and the confusion and chaos that breast cancer puts in your life, you were already busy with work and home. You didn't really need this to happen. All that chaos and confusion that gets introduced when you're first diagnosed. People will start asking you questions. This just adds even more to the fear. Are you going to get chemo? What kind of surgery are you going to have? This is what I did. And they're pouring information on you. You're going from doctor to doctor. You think you need to see the doctor yesterday. They can't see you for 2 weeks. Is it going to spread while I wait? These are all natural fears that I've learned from my patients and that I can only imagine would arise. So a couple things I can tell you have helped my patients. I haven't been through this, so I want to be really careful and tell you this is what I've learned from my patients. The first thing is to stop and pause and say, I'm all right now. I need to gather more information. Once I have more information, I know what to expect. And then you feel a little bit more in control of your life. I think it's common when we don't know what's going to happen to think that all these things are going to happen to us and we don't actually know what to prepare for. So it just feels like we have to prepare for everything, every possible eventuality. If you can practice mindfulness, which doesn't mean sitting cross-legged in a lotus position, it means just being here and now in the moment. And if you can learn to ask yourself, what do I need right now? What do I need in this moment? It can make things feel less catastrophic and less overwhelming. So you know what you know right now. A plan is being laid out, but when? It will happen, and you can partner with your medical team to help you know, is this a medical emergency? When should I have these tests done? Why am I not having some tests? So being fully informed with what you do know in that moment and what you need to find out next can help sort of break things down. You've had other periods of uncertainty in your life. How did you handle those? Use some of those same strategies to get you through this crisis, because it does feel like crisis. If you want to learn about the different types of treatment you might be offered or that might be part of your treatment plan, visit Yerbba.com. Who else can help you with these fears and the sense of overwhelm and that sense of crisis, in addition to your medical team? There are people in your life who want to help. They may feel powerless and they may get mighty annoying. So you want to pick and choose who you talk to. We actually have a video series on how to talk to your partner, how to talk to people at work, how to talk to your children about what's going on. But finding somebody who's been through this can actually be really helpful, as long as you're not careful to take on their story as well as your own. It's like picking up a heavy coat that isn't yours and then trying to go to all your appointments with their story. So you might find that having another person who's been through it is less helpful. On the other hand, you might find it really helpful. And not to brag, but our videos are actually pretty helpful too on what to expect. We've tried to anticipate all the questions you might ask. If there's one you have that we haven't covered, put it in the chat. We'll cover it. We're always looking for good ideas. So when you're first diagnosed, getting information and getting support, knowing your story is your unique story, really helps. I've made the analogy to a book before. If you were to take a book and take chapters out of somebody else's story and stick it in with yours, that would be really confusing. You're going to have your one and singular experience, right? So just, manage the amount of information that you're getting so that it's not too much. Try not to get too far ahead of yourself. I'm not saying you can't handle information. I'm saying that if you're experiencing fear, too much information might not be the right strategy. And a lot of people have told me when they are first diagnosed, they learn absolutely everything they can, and once they start treatment, they try to just limit to what they need to know here and now. However you cope, whatever's best for you is the right way to do it. So now I'm going to talk about you're going through breast cancer treatment, or you're about to have a particular treatment and you have fears. So let's say you're about to have a mastectomy, removal of the breast and neighboring lymph nodes. Watch a video that we have. You can just search on Yerbba with the topic that you want to know, and we've tried to equip people with the right information, and know that you're not going to get every side effect. So as you learn about chemotherapy, it's very uncommon for every single person to get every single side effect. You're going to get some, but not all. So ask your team, what are the most common side effects? Which ones might happen but are less likely, and which ones are really rare? Some people like to know even the ones that happen 1 in 1,000 chance. Let your doctor know what your information needs are. You might not get them all met in that visit, but they can send you to the right place to get more information. When you're going through breast cancer treatment, a lot of it's sort of pre-scripted for you in a way, not just prescribed by the doctor, but there's sort of a pattern. So it can be very comforting to know after 4 cycles of chemotherapy, I'll have surgery, I may get more chemotherapy, and then I'm going to be on this, depending on this different branch point. I actually, for my patients, will sometimes make out a decision tree. So if they have chemo first and all the cancer is gone, they'll have surgery and then they'll proceed to radiation therapy. There are other people where they won't have a complete response and they might get additional therapy. So I make a little decision tree. If that kind of thing is helpful to you, let your doctor know. Pictures for some people are more helpful than a lot of words, and we sure do have a lot of words. Another place to go is to look at Yerbba.com, because that's our intent, is to tell you what's coming next and also what you might expect with each type of treatment. So I'm not going to go into every treatment modality and what people fear. What I'd like to cover next is when treatment end is approaching. You've done all the parts of treatment that have been laid out for you. A lot of people start to feel like they were plugged in with a system, they were seeing people every 2 to 3 weeks, or if you're on radiation once a week, what's going to happen now? That can actually be very anxiety-provoking time for people. And I think it's especially hard because you and everyone around you thought that you'd be celebrating. There's some places where they ring a bell when you're done with your last treatment. And while that's helpful for some people, they may feel like it's a false ceremony. There's something that doesn't feel quite right because you're still living with those fears. What if the cancer comes back? What if I don't feel better? What if my kids get cancer, right? We can come up with a whole host of things we're afraid of, especially if you're not feeling great. You may be wondering why everybody is having a party around you and you just want to curl up in bed. So again, everybody's different, but this is a period of time that I tell people to expect many different things. And one thing that can be really hard is you're still living with fear and everybody else wants to go around their merry way as if it never happened, that things have returned to normal. We've covered this in other videos. It doesn't really go back to normal, right? Your life is permanently affected by what happened to you. Even if physically you feel fine, it changes the way you view medical tests or how you feel about getting a mammogram. There's no routine mammogram anymore after breast cancer. You'll notice that. They do more pictures and they spend more time looking at your mammogram. So we don't really go back to normal. Some people have described a new normal or a different person, or they'll call it BC, before cancer, and AC, after cancer. So, just let yourself have your own feelings. And you can ask your team, what should I expect now over the next 6 to 12 months? Or what can I expect over the next week? Or who do I call if I feel something? So it's a really important time to feel that you have a summary of what happened to you, and Yerbba can certainly help with that. Go to Yerbba.com because we map out all the things that you've had done to you, all the tests you've had and all the treatments you've had. But your doctor can also help fill in, why did I get this chemotherapy versus this one that my neighbor got? It's a time new questions come up. How can I prevent long-term side effects? How can I take the best care of myself? So you have new questions. That first appointment after you're done with treatment is a really important appointment, to be honest. It's not a quick in and out. And if you need more time, your doctor can break that up into a couple of visits for you. So going prepared with your questions is really, really helpful. All right, now I'm going to be talking about fears of recurrence. What do you do if you get a symptom and you finish your cancer treatment and you're just now in what we call routine follow-up care? How do you deal with fears? Let's say you get a pain in your ankle or your elbow, or you get a headache, or you notice side effects of your hormonal treatment or endocrine treatment. They're the same thing. What do you do? Well, one of the things that I have learned from my patients is the 5-day rule. So if you have symptoms that last 5 days or more, and certainly shorter than that too, reach out to your medical team. And I do recommend that you reach out to your cancer team. It's very, very possible that your medical oncologist will say, I'm not worried about this. Please see your primary care doctor. That's a very common and appropriate thing to do. This is a time where you integrate back with your primary care doctor. We're not really good at primary care. We're not good at managing cholesterol or diabetes. You've probably noticed that already. So getting looped back in with your primary care doctor is a good thing, and staying in close touch with them during treatment's one way to help decrease this sort of re-entry period, is what a lot of us call it. But if you have a symptom that lasts 5 days or more, even if you think it's just a cold, don't hesitate to reach out to your medical team. You're not bothering us. We would much rather have our nurse tell you, sounds like a cold, everybody around you's been sick. You didn't bother the nurse. You actually made their day, right? Because they got to give you good news. So don't worry about reaching out. The other thing is to think about a support group. It's very possible that support groups sounded like the last thing you wanted when you were first diagnosed. And we've actually talked about that on previous videos that will pop below. I did an interview with Rosie Morrison about support groups. It's a really, really helpful video because it talks about when to seek out a support group. And we acknowledge when you're first diagnosed, it's a good place to go pick up a lot of other quotes or stories from other people. You only have your one story. But this might be a perfect time for you to get connected with other people who've been through this, because if it's led by a professional, and those are the kinds you'll remember that Rosie and I recommended, you'll see common themes. And one nice thing when you're going through this is to know you're not alone, and to hear, how did you manage that? How did you manage that? Or for your support people to go to a support group for support people. How did you handle this when your partner got really anxious? It's also a good time to talk with people you're close with and just say, it's normal for me to feel scared. Don't tell me it's all going to be okay. Let me have my feelings. You need to have the entire wheel of feelings in life. We can't avoid hard feelings. Talking about your fears doesn't make them come true. A lot of us are superstitious. If we say this thing, it's going to come true. And that's actually not the case. Opening some light onto your fears can really help. Now, if you're somebody in whom the cancers come back, of course you're going to have a whole lot of different fears. We'll probably cover that more in detail in another video. But if you're living with cancer that's recurred, again, it's important that you be able to talk about the things you're afraid of. And I have to tell you, you're not the only one being afraid of them. So if you're in a partnership and you're worried about dying of breast cancer, your partner probably is worried, what happens if my partner dies of breast cancer? So again, bringing some light in the room, seeing a support person, a therapist, a counselor, social worker. Cancer social workers are trained. This is what they do to help manage that uncertainty. I've covered a lot. I've covered fears when you're first diagnosed. I've covered fears right before you get a particular type of treatment, fears when you're on treatment, fears when treatment's over, and fears when the cancer comes back if it does. How to handle that for you and the people in your life. I hope it's been helpful. If it has, click like and consider subscribing to our channel so that other people just like you can find this information.